ASMR. Hi, welcome to Sleepy Time ASMR Clinic. My name is Emily and I'm one of the practitioners here. How can I help you today? Okay, so you're here for a cranial nerve exam? Perfect. Why are we doing an exam on you today? Okay, so you hit your head and you got a concussion? Okay, well, we can definitely assess your nerves. So I will just get you checked in. Can I just start out with your last name? Okay, and your first name? Perfect. And what is your birthday? Wonderful. And what is your street address? And city? Wonderful. And do you want to add an email address? Okay. Okay, wonderful. Alright, so I have you all checked in. So I will be taking notes during our exam. But first, just a little bit of backstory. So cranial nerve exam is to check your senses. So you do have 12 sets of nerves in your head. They all control different sensory functions. So we are going to be checking your sight, your hearing, your taste, your touch, and your smell today. Nothing should be unpleasant. However, if anything is uncomfortable, just let me know right away, okay? I will be getting pretty close up in your personal space just for some of the assessments. So if you're uncomfortable with that, just tell me, okay? Wonderful. All right. So just gotta get some of your past medical history before we begin, okay? Are you allergic to anything? Okay, and what about any foods or tastes? Okay, and the reason we ask that is because testing your sense of taste, we don't want to give you something that you are allergic to, obviously. Okay. Okay, and do you take any medications on a daily basis, prescriptions? And the dosage on that? And how often do you take that? Every day? Or twice a day? Okay, and what are you on that for? Okay, wonderful. And is there any past medical history that we should be aware of? Okay, and when was that? Okay, I will make note of that just for your file. Wonderful. Okay, so let's get started. So, we are going to start with just a visual assessment, and then I'm going to do some palpation where I'm going to touch your face, just kind of look around your eyes, everything like that, just to make sure everything's good before we get into testing your senses, okay? Alright, so let's just start out with a visual assessment. And I am just looking to see if your face is symmetrical, making sure you don't have any type of facial droop, which could indicate Bell's palsy or a CVA, which is a stroke in layman's terms. But everything looks good. Just going to sanitize my hands. Okay, so I'm going to palpate your face, which is fancy terms for just pressing around your face, okay? let me know if anything's uncomfortable, okay? Wonderful. I'm just gonna start with your forehead, your temples, your eyebrows, under your eyes, your nose, your cheeks, and your chin and your neck. Can you open and close your jaw for me like this? Okay, and go sideways. Wonderful. Was any of that uncomfortable? No? Perfect. Alright, so we are going to start out with testing your sense of smell. So I have 4 different smells. And what we're going to do is I'm going to get you to occlude a nostril, and I will hold them up, and you will tell me what you're smelling. Okay, so I want you to start out with plugging your left nostril. Okay, and I want you to take a sniff. And what is that? Orange. Good job. And next, I'm going to get you to plug your right nostril, okay? And take a sniff. And what do you think that is? Lavender. Good job. It smells nice, right? And now I don't want you to plug either nostril. Just stay open. Smell that? What do you think that is? Good job. It's lemon. And the last one, it's a little bit sweet. It's very nice. Take a sniff. What do you think that is? Vanilla. Very good. It smells nice. Okay, so I'm just going to take a note here. Okay, so your olfactory, which is your sense of smell, is intact. So no concerns with that. Alright, so next we are going to move on to your sense of taste. So I have 3 bottles of tastes here, and what I'm going to do is I'm going to put a drop on your tongue, and you're going to tell me what it tastes like, okay? Perfect. So let's start out. I want you to close your eyes. Close. And stick out your tongue. Okay. And open up. Did that taste like? Strawberry. Good job. Okay. So, number 2. So same thing. Close your eyes and stick your tongue out. Close. Tongue out. What did that taste like? Chocolate. Good job. And the last one. Stick your tongue out. What did that taste like? Coffee. Good job. Alright, so let me just take some notes, but your sense of taste looks perfect. So, smell and taste both look perfect. No concerns at this point. So now we are going to move on to your sense of hearing and see how your ears are. Just to start out, do you have any issues with hearing? Okay. Any plugged sensation or pain in your ears? Okay. And do you have a history of ear infections as a child? Okay. Alright, so what we're going to do is I'm going to feel around your ears to see if there's any pain that could signal something called otitis externa, which is like an external ear infection. So let me just kind of palpate around your ear, see how it feels, and then we will actually test your hearing, okay? So I am going to start out with your left side, okay? Any pain? Okay, and moving on to your right side. Any pain? Okay, so I'm going to make some noises into both of your ears, and I just want you to close your eyes and tell me which side are you hearing this on. It's going to be like that noise, okay? So I want you to close your eyes and tell me what side do you hear this noise on. Close your eyes. Your left. Your right. Right. Left. Right. Good job. So now I'm going to whisper words in your ear on each side until I need you to tell me what I'm saying. So close your eyes. And we'll start out on your left. 22. And on your right side, hamburger. Good job. And on your right, green. And on your left, crystal. Good job. So you can hear all right, no pain. Everything looks good with your ears. So let me just take some notes. If you find that you have any problems with your hearing down the line, it would be worth scheduling an exam with an audiologist. They do have all the specialized equipment that they can do your ear pressures, look in your ears, check if you have fluid in your ear, any type of effusions, which is basically like fluid or air behind your tympanic membrane or your eardrum. So that would be worth looking into if you ever do get hearing issues in the future, okay? Wonderful. So let's move on to your sense of sight at this point. So we are going to start out with palpation. I'm going to feel around your eyes. Just make sure nothing's painful and that everything looks okay. Okay, I'm gonna get a little bit closer to you for this, okay? Okay, just relax. You can close your eyes if you want to. I'm gonna start out with your right eye. Just gonna feel underneath and up top. Okay, and I'm gonna do your left. Are you having any pain with any of that? Okay, so I am just going to start out by pulling your eyelid down and getting you to look up, okay? So I'm gonna pull down and I want you to look up. Okay, and now I'm gonna pull your eyelid up and I want you to look down. Look down. Good. I'm gonna do that on the other side too, okay? I'm checking out your sclera, which is the whites of your eyes. So let's start out. I just want you to look up. Okay? And same thing from the top. I want you to look down. Perfect. Wonderful. Okay, so I'm going to shine my phone light into your eye just to make sure that your pupils are contracting and dilating the way they should, okay? So I want you to look directly at my nose and I'm going to shine a light in your vision. Just ignore it, look directly at me, okay? Perfect. Okay, so look at my nose. I'm going to shine a light into your left pupil and I want to make sure that your right pupil constricts. That is called consensual response. So just look right at me. Okay, perfect. And same with the other one. Just continue looking at me. I'm going to shine a light in your right eye, okay? I'm going to check your left pupil. Good. So, now I'm going to get you to follow this highlighter, okay? So stare at the end of it. I'm going to be going far and close just to check out how your pupils are accommodating, which means following close up, far away. So look at the highlighter, bringing it back, and then side to side, up to down, close and far, and close and far. Good job. Okay, you did wonderful. So now for your vision, we are going to check your colors. Make sure you're not colorblind. So I'm going to hold up 4 different highlighter colors and I just want you to identify the color, okay? Okay, color 1. What color is this? Purple. Good job. Number 2. Color. Pink. Good job. Number 3. Color. Orange. Good job. And number 5. 4. Number 4. Yellow. Good job. Now, I am going to get you to cover your left eye, and I want you to read line 5. Okay. Perfect. And I want you to cover your other eye, your right. And can you read line 6? Perfect. What about can you read line 10 by any chance? Perfect. You've got great vision. All right. So, for a more detailed eye assessment as far as checking your visual acuity, I do recommend going to an optometrist because they do have the specialized equipment, that chart, which is the Snellen chart, just to correct your vision, see how it is, and assess accordingly. So I definitely recommend making an appointment for that, okay? Wonderful. Other than that, though, you have no signs of color blindness. Your pupils are good. They are responsive. They accommodate properly. So I have zero concerns about your vision, okay? Your optic nerve is functioning the way it should be. Perfect. Okay, so that leaves us to our last exam, which is my favorite, your sense of touch. So let me just grab a couple things here. There are two aspects to this exam. So number one, I'm going to use this skewer. It's wooden, it's sharp, it will not penetrate your skin. It's pointy, but it will be fine, I promise. It will not hurt. And what I'm going to do is I'm going to get you to close your eyes, and I'm going to touch your skin in various parts, and I want you to tell me where I am touching you. So am I touching your forehead, your nose, your chin, cheeks, temples, neck, eye? Just let me know. Nothing should be uncomfortable, okay? So close your eyes and tell me where I'm touching. Forehead, nose, chin, left cheek, right cheek, your neck, good job, your right temple, and your left temple. Okay, great job. So now, the second part of this exam is I'm going to use this tool. So this is a blunt metal dotting circular end that I will touch your skin with. It is cool and cold. The opposite side is very soft, fine, pointy brush. Very, very soft. So I'm going to touch you with either the brush or the cold metal side, and I want you to tell me whether it is soft or hard. Okay, soft being the brush, hard being the metal. So close your eyes. You don't need to tell me where I'm touching you, just whether it's soft or hard. Okay, close your eyes. Okay, ready? Soft. Soft. Hard. 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 Soft. Soft. Hard. 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 Couple more. Soft. Soft. And they're right there. Soft. Good job. Actually, the very last part we're going to do is two objects that are the same material but different sensations. Got a cotton swab, which is kind of more firm, concentrated area, versus a cotton pad, which is the same material but it's very soft and flexible, whereas this is firm. So I want you to tell me if I am touching you with the swab or the pad. Okay? You don't have to tell me where, just which it is. Close your eyes. Okay. The pad. Pad. Swab. 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 The pad. And the pad. Good job. Alright, so now we are going to check just basically your strength in your face. Just rules out any CVA, which again is stroke symptoms, okay? So give me a big smile. Perfect. Raise your eyebrows. Perfect. Puff out your cheeks. and don't let me pop them. Good job. I'm going to put my hand beside your face and I'm going to try to press, but I want you to resist, okay? So, resist, don't let me press. Good job. And same with the other side. Resist. Good job. Stick out your tongue. Wonderful. And go cross-eyed. Good job. Alright, everything looks good with that nerve. That's your trigeminal nerve, so no concerns with that. Your trigeminal nerve is intact and very good. Alright, so I will write up a formal report to send to your primary care provider, your family doctor, just entailing my findings, but unofficially everything looks good. I did not identify any cause of concern. All of your senses are intact, so nothing was impacted with your head injury. Other than that, do you have any questions before we are done? Okay. If you do have any questions or if anything changes, please do not hesitate to come back for a reassessment. We can book you back in for a re-examination if you do feel that any symptoms are worsening or progressing, okay? But other than that, we're all set, and I hope you have a great day. It was very nice meeting you. Okay, thank you.